is Icterus. Icterus is also called jaundice, and it is basically, it's the clinical condition that results in discoloration of mucous membrane, sclera, and skin. And it's the result of bile salt deposition in tissues from abnormal bilirubin metabolism. So hyperbilirubinemia causes Icterus, but it is not the same thing. So hyperbilirubinemia is the elevated bilirubin. Icterus is going to be that clinical manifestation of the hyperbilirubinemia. So bilirubin is produced in health from the destruction of old red blood cells. So that's normal. And so all the time, red blood cells are being destroyed and being metabolized. And that's why there's always some level of bilirubin in your blood. But it becomes abnormal when there are increases in either more destruction of those red blood cells, or if the bilirubin itself is, if there's some issue with metabolism or excretion of that bilirubin. Bilirubin is that breakdown product of hemoglobin, and you can kind of see here the red blood cell is going to get broken down into hemoglobin. That hemoglobin is going to get broken down into a heme ring, and the globin or globin chains. And that heme ring then gets broken down into iron and bilirubin, which is really the component that we're sort of talking about here today. The bilirubin then gets metabolized in the hepatocyte, and eventually bile is going to be formed. Bile is essentially just a combination of water, these conjugated bile acids, bile pigments, cholesterol, and some inorganic salts. And it's going to flow from the hepatocytes through the bile canaliculi into the bile ductules, and then the bile ducts, and then eventually the hepatic ducts, and then into the duodenum. So basically, it's just going to make its way from the hepatocytes into the duodenum. Once it's in the duodenum, it actually gets further broken down into a couple of different components. One is urobilinogen, and then the other is stercobilinogen. And you can kind of see that here on this graphic. I guess the bottom part of that is the intestinal part. So you can kind of see here the bilirubin is going to start in the vasculature. That's the top part of this diagram. It's going to go and get metabolized in the liver, and then from the liver, it's going to travel down into the intestine. And then again, it's going to get broken down into that urobilinogen and stercobilinogen. Stercobilinogen is going to be excreted in the feces. It actually is partially what imparts color to stool. And then the urobilinogen is going to undergo enterohepatic recirculation and then eventually be filtered through the kidneys. Some of the conjugated bilirubin is also freely filtered by the glomerulus and renally excreted. One thing that is different between dogs and cats is that the renal threshold for bilirubin in dogs is quite low. So it is actually normal to see some amount of bilirubinuria in a dog just in health. That's not necessarily abnormal. However, the renal threshold is quite high in cats. And so in cats, any amount of bilirubin in the urine should be considered abnormal, whereas some amount is completely normal in a dog.